Greetings, good morning, good afternoon, good evening to all of our students, our staff members, our repeat visitors, and our new visitors to the UWIHARP SHAZ podcast series. My name is Kelia Anderson, your moderator for today, and I am the project assistant here with UWIHARP. UWIHARP is the HIV and Sexual Health Unit here at the University of the West Indies, Cave Hill campus. And we seek to positively influence the sexual and reproductive health and wellness of the university population and the wider Caribbean society. Our primary focus is the development of sexual health literacy among the community through programs such as these, our UWIHARP SHAZ podcast series. And we are in our second episode. So if you missed the first season, this is our second season. If you missed our first season, I encourage you to log on to YouTube, log on to Instagram or our Facebook, search for UWIHARP Cave Hill, and all of our episodes are there that you can view at your convenience. If you have any suggestions of new ones, or if you have any questions emerging from what you have seen, feel free to drop us an email and we will be sure to get back to you. Today we are touching on a topic that we think that only affects more mature women, but we know that this can affect many relationships. This can affect many people in different ways. And I'm also going to throw in there and ask Dr. Whitby, how does this also affect trans women, if it does at all, because we know we're dealing with hormones and these different things. And because we seek to be very inclusive, we're going to be touching on a variety of things of how menopause affects individuals. So today we have our very own Dr. Tania Whitby-Best. She's our resident doctor here at the Student Health Services. And Dr. Whitby is a graduate from the Faculty of Pure and Applied Sciences, UWI-Mona, in 2002, and the Faculty of Medical Sciences, UWI-Mona, in 2005. Following her completion of the internship at the QEH, she joined the Department of Odontology and then subsequently joined the Family Medicine, Doctor of Medicine program, which she completed in 2014. She is presently the medical officer and the head of the Student Health Clinic, UWI Cave Hill campus, and a part-time tutor with the Faculty of Medical Sciences here at the UWI Cave Hill campus. She is presently the Honorary Secretary of the Caribbean College of Family Physicians and has served on other professional committees such as Junior Doctors Association. Besides the practice of medicine, Dr. Whitby-Best has a keen interest in the performing arts, especially dance, and has been an active dancer and choreographer during her post-university years. So welcome again, Dr. Whitby-Best, and thank you again for agreeing to do a very timely conversation on mastering menopause. And we know that sometimes people often think that this only affects mature people, but we know that in living in large households and having relationships with persons and so on, menopause affects not only the individual that is going through it, but also those that are around them, and they need a healthy and supportive community around them to get them through this process. So as we begin, I'm just going to ask you to give us an overview of what menopause is. We know is a stopping of hormones. We know it's a natural response that our bodies go through, but still yet some of us are not often ready for it when it comes. So let's start there. What is menopause, and does it only affect cisgendered women?
Well, so thank you for having me, and thank you for the introduction.
You're welcome.
And I mean, menopause is something that we all have to deal with at some point in our lives, whether ourselves as women or our families, as you've mentioned. Now, the word menopause comes from two Greek words: meno, that means month, and pausis, that means halt. So it's really defined as a permanent cessation of your menses, right?
Yes.
Your period. And usually, if in a woman who was previously menstruating and you go a full year without having a menstrual flow, then that would indicate menopause has occurred, right?
So what happens if it is not a full year? Then no, it has to be a full year.
Well, yes, if it's not a full year, you really should investigate. If you've gone, say, 6 months and then it came back, you really should go to your doctor and have that checked out, right?
Okay. Okay.
So yes, we do say a full year without a menstrual flow, right? In a
Okay.
previously menstruating woman. And we expect that by age 58, almost 100% of women would have gone through this, right?
Okay. Based on
So
science.
yes, based on science, based on
Okay.
the age, the group. I mean, in the USA, they state that the process vary between age 40 and 58, and there's no one cap that fits everybody as what it will look like for them and what experience will be.
Okay.
So you will hear me talk about a terminology called menopausal transition, because it's a transition, it's a timeline. It's a timeline. It happens over a time period.
Yes.
It's not, you just one day and you have menopause and you're done.
Yes.
Right? Doesn't work like that. So
Okay.
it does over a timeline.
Yeah, so the same way that puberty takes a timeline,
yes,
and its reversal, there's a timeline. Okay.
You did ask who goes through menopause. You asked me, is this, you mentioned trans women. So just for clarity for our audience, when we talk about cisgender, is a person who identifies with the sex they were assigned at birth, right? So if you were born with vagina and you were assigned female, and that's what you identify as, okay? While transgender is person whose their gender identity and expression, it doesn't match what they were assigned at birth. And persons who are transgender oftentimes use different medication or so forth to align their bodies with their gender identity.
Yes. Okay.
So when we talk about trans women, they are more than likely going on hormones therapy. Estrogen more likely, which is what is problem in menopause, is that your estrogen levels are falling, your ovaries start failing, which is what produces estrogen, right?
Yes.
And there are other hormones associated with that, progesterone too, and so forth. But the main one, estrogen.
Yes.
So a transgender woman may be on estrogen to get, as I said, the body to align with the gender identity. So the whole experience of menopause, we really have been discussing it around cisgender women, right?
Okay.
Because of that response to the reduced function of your ovaries.
Okay.
However, trans women can experience symptoms of menopause as well. And this they tend to find in some older trans women, because they may start decreasing their estrogen dosage, or in some cases stopping it altogether, right? And then can experience the symptoms in response to that hormone change and fluctuation.
Yeah. Okay.
Even though, so the root cause is different. It's not the ovaries reduced function,
but it's the reduction of the specific hormone that
yes, exactly.
Okay. Understood. So would that lead them to have some of the other symptoms associated with menopause, or no? Or is that only for cis women?
So they can report some of the symptoms.
Okay.
Can't say exactly how many will, because again, it's going to vary from individual. But of course, as you would think, if you're getting your estrogen dosage and that drops, then of course it comes with certain, it's almost like a side effect then of the decreased estrogen levels that your body was getting. So yes, they can come report some symptoms of menopause also.
Okay, so what are some of the common challenges and symptoms associated with menopause? I know
Well,
people often
that's
talk about
complex.
hot flashes. That's a major one.
Yeah, and
And
most
mood
people don't
swings.
associate
Yes.
hot flash with menopause, right? All the time. But the challenges and symptoms, it's complex and it's gonna vary from woman to woman, right?
Okay.
Um, we know that about 85% of women with menopause will have some form of symptoms associated with menopause, and I'm going to talk about them in a bit because there are several that could happen.
Mm-hmm.
Only about 20% will report significant symptoms. These are people who just can't function because of these symptoms, right?
Okay.
Their lives really hard to function.
Mhm.
So the commonness, and this is more common among Caucasian women, of course, is the hot flashes and the
Okay.
night sweats. And that's because related to how you thermoregulate your temperature, right?
Mm-hmm.
So, the patient might say they feel clammy and they feel anxious and their heart racing, and it's gonna vary how it happens and when it happens. It's almost unpredictable as to when these hot flashes will come on,
Mm-hmm.
right? So, you know, when they look at the risk factors for who will get hot flashes, they did a study, and again, as I said, race and ethnicity
Plays a
vary.
major role. Mm-hmm.
Yes, the self-reporting of persons of hot reporting going through menopause reporting hot flashes vary based on race and ethnic background,
Okay.
and also there is something linked to your physiological makeup, whether persons have diet that are high in certain products like soy,
Mm-hmm.
and just people's different perception of menopause. You
Mm-hmm.
know, is it really a hot flash? Was it something else? And they found that women who started the transition earlier, who had a history of like anxiety, or higher stress in life,
Yes.
yes, are more likely to report hot flashes. So
Oh,
that's what the studies have shown. Um, and that's the most common, one of the most common complaints persons will have.
okay.
But there are also other things menopause can affect. I'll talk here about, sexual dysfunction and, vaginal dryness.
Yes.
Vagina gets irritated, it burns, sex is painful. So that can lead to sexual dysfunction.
Mm-hmm.
It also can make, passing urine painful, and frequent urinary tract infections because the hormone estrogen, again, it
Yeah.
affects how that urinary sphincter that we can control and hold our urine.
Yes.
It affects that muscle, the tone.
Mhm. Yes.
Okay. So sometimes, older women going through menopause might say they cough and they pass a little urine, they might have to wear things to
To
help
assist. Yeah.
that. Yes. And in some cases it can be pretty bad. But
Mm-hmm.
the vaginal dryness too is also a major factor. And as you mentioned before, in terms of relationships, a woman is married or involved with a partner. And this can also lead to, low libido.
Yeah.
You might not want to have um, sexual intercourse because of all of these things that are happening. Um, so, is it can be managed. Yeah, there, and we'll
Yes,
get
they
to that
can.
eventually. But that's one of the other problem that they have. And mood,
Yes. Emotions. Mm-hmm.
studies, yes, have shown increased risk of depressive symptoms throughout the whole, as I mentioned before, menopausal transition that person can.
How long is that likely to take, that
That's
transition?
the thing. There's an early stage and a late stage, and the early stage vary from many people. For people, it can be as little as a few years to many years. But the late stage of it, right? The late stage is about 1 to 3 years, right?
Wow.
So there's no two persons who may be going through the same thing over the same time period.
Okay, so in terms of um management,
Mhm.
what does that look like for an individual? Because there's so many um aspects of a person's life that are affected. How would you advise a person if they say, well, they think they're starting this process? Are there tests that they need to go through? What are they? What was that experience like? Do they need to change their diet? Do they need to start exercising more? I know that's often, the remedy for most things, eating healthy and exercising more, I don't know, drinking more water. What does that look like when a person thinks they're now starting to start the process, the transitional stage of menopause? Do they take a
Well,
specific
I mean,
test?
the main objective, you'd of course be advised to discuss with your healthcare provider, your
For
doctor,
sure.
right?
Yes.
Especially if you're having troubling symptoms, severe symptoms.
Mhm.
And the main objective, or the short-term objective, really you want to alleviate any bothersome symptoms that result from that low estrogen levels, right? Because as I say, it's a process. It will happen. It has to happen.
Yes.
So it's about trying to provide support, whether emotional, to deal with all the problems, or any of the functional or emotional problems that the patient may be experiencing. So that's
Yes.
why, it's advised that you do see healthcare provider if you're having anything worried. The consultation will determine if we need to do blood tests or not, right? There are other risk factors that we do look at in terms of cardiovascular, bone health, and so forth, because estrogen levels fall, the risk for those things increase. Cardiovascular meaning like heart attacks, risk for heart attack.
Yes. Okay.
Health. I don't know if persons ever heard the term osteoporosis. So, basically
That's your
weakening,
bones. Yeah.
more at risk for fractures, things like that.
Especially in women. Yeah, I've found research where they fall and they have a lot of hip fractures and so
Exactly.
on.
Right.
So I guess that
So,
is linked to that as well.
so the whole discussion is important as to what's happening and
Mhm.
how best you can alleviate these possible risk and complications, right?
Okay.
So, there's evidence that show that women who are more active, can you mention exercise? Who
Yeah.
are more active
Mhm.
tend to suffer less from the symptoms of menopause. So exercise, again, coming up all the time, no matter what you're discussing health, exercise is
Exercise.
always
It's always the healthy, wholesome body.
exactly. For any ailments,
Mhm.
exercise, you need to exercise, right?
Okay.
Um,
Yeah.
and it improves not just the symptoms, but your mood,
Yes.
your life, Um, some women with menopause will complain that they can't sleep. So it helps with that. And
Mhm.
when they looked at the persons who were exercising as opposed to those who were not exercising, they realized that there was a difference in these things,
Yes.
when they compared the two groups, right?
Mhm.
Even yoga, there's evidence that yoga is beneficial
Yeah.
in reducing those hot flashes and just improving your whole well-being.
Yeah.
So it's exercising, avoiding or reducing your alcohol and caffeine intake, right? And it makes
You
sense.
don't like to hear those things, but
If
yeah.
it makes sense, if you get hot flashes and your heart racing, what caffeine do? Caffeine can make your heart race sometimes. It makes sense. Right? So it makes sense that, maybe look at reducing if you
Mhm.
can't stop, because some people really love their coffee.
Mhm.
Or
Yes, so that's why it's important to see your healthcare provider. They can help you put that management plan in place
yeah,
because we know that coming off of those types of substances sometimes can lead to other issues as well,
yes,
withdrawals and other
right.
things.
So it's just to get advice as to go about. It's not easy for someone to stop, using certain things if they're used to it and so forth. But you can get
Yes.
guidance to do it, and
Mhm.
alternatives
Yes.
depending on what you use. So if you're using coffee to stay awake or get the perk, what alternatives would be there? So that's a discussion you can have. You can also be referred to a dietitian who can, go through the whole thing, look at your weight,
Yeah.
uh, helping you with a diet plan,
Mhm.
We always advise weight loss for persons who are overweight or obese.
Okay.
That's always beneficial in reducing risk factors, especially for heart problems. Okay.
So
So
are
that's
there
always,
programs set up in, do you know of any programs set up in Barbados that aids in assisting women in this transition?
I can't
Other
think
than
of
the
the top
partner
of my
stroke that
head.
maybe helps as it relates to obese challenges and so on.
Um, I can't say right now off the top of my head.
Okay.
Right?
No, that's
I
fine.
think I remember seeing something recent. I can't remember right now. I know there is a program. Oh, it's not coming to me right now. Actually one of our obstetrician gynecologists locally does support women who are going through menopausal changes, but I can't give the details right now.
That's okay. We could always follow up with some information after. So we're talking about diet, having a good support system, making sure you speak with your healthcare provider to make sure you have the best plan in place for moving forward. And really trying to take care of your body holistically because it affects everything around you and within you. You spoke about sexual dysfunction. And when I hear sexual dysfunction, that means you're not in a position to have sexual intercourse with your partner. Are there ways in which persons can remedy that, or do they have to stop completely? Also, as we're on this topic, do women then still need to have pap smears done and healthcare testing when they're going through this process?
So with regards to helping with even sexual dysfunction,
Mhm.
and when you talk about menopause, you have to talk about hormone therapy,
Yes.
hormone therapy.
And you
And
can
there's
just explain what that is.
so and I mean, of course, this will be decided by your healthcare provider,
Mhm.
but they may look at giving estrogen therapy. It's really still the gold standard for relieving the bad symptoms of menopause, like the bad hot flashes and the vaginal problems that patients may complain about, right?
Yes.
To note, there are non-hormonal approaches. So, women can have choices, but it just depends. As I said, one hat doesn't fit all. So
Yes.
it's individualized.
Mhm.
So benefits of the hormone therapy, you get symptom relief. You feel like you used to feel before,
Yeah.
it reduces your risk of the bone problem, the osteoporosis, sorry, and it relieves the hot flashes in over 80% of women who use it.
Nice.
And the dryness in the vagina is noted to respond well to both topical, meaning like creams,
Mhm.
or if you were taking the
Taking it.
tablet,
Okay.
so that definitely is one of the benefits. But of course, you will hear, don't use them for too long because there are also risks associated with hormone therapy. Okay.
Okay. What are some of those risks? Can you share them?
Increased risks for clots. We said thromboembolism, but we mean clots. So can form clots in the lungs or the legs.
Yes.
Cancer risk increases,
Mhm.
right? As well as endometrial cancer, which is the cancer of the womb itself or the uterus. Okay. That risk increases. All right. Heart, sorry, you can get a slight increase in your blood pressure and things like that. But those are some of the major risk factors that persons would be worried about. And as such, it's not advised to use hormone therapy for too long. Again, the length of time will be determined between you and your healthcare provider because it varies based on
How
what
your
symptoms you're
body,
having,
yeah.
how you respond, things like
Mhm.
that.
So then you
So
can maybe come off and take a break and then maybe go back on, or when you stop, that's it.
no, it's not a matter of stopping full, but
Okay.
it just depends on how long too you were on it before.
Okay. Okay. So it's really management of it. Okay.
and monitoring. Yeah.
Okay.
Now I mentioned before some other alternatives. So there are some herbal
Yes.
things on the market. I'm sure people are aware of black cohosh, right?
Mhm.
Ginseng and ginkgo. These are some herbal remedies that may help with like hot flashes and some of the mood issues that persons may have and giving some energy, right?
Yes.
And then persons would try like acupuncture and all kind of things, diet and
Okay.
supplements, vitamins and so forth.
Mhm.
But one important thing to note is that although there are women who will say they find this treatment helpful, the research studies have not really proved that most of these treatments are more effective than someone who didn't use them, right? And then there's always the concern about efficacy and safety,
When
with
it
how
comes to
much you use it.
natural, yeah.
Yeah, and that kind of thing. Because I always tell persons, even though it's natural, there still has to be a dosage. There still has to be some
I
form.
think that is a challenge across the board. We know that
Yeah,
they
you,
do work, but it's
you
how much
use
do
it
you
every
take for
hour.
how long and how many
Exactly.
times,
And
you
how
know?
many times? Yes.
Yeah,
So
hopefully they will get it some right
we,
sometime, you know.
so that's why it's best to use these things with guidance,
Yes.
Make sure you're following proper guidance, because so you don't have any adverse reaction or any problems with them.
Yeah.
Always good. Again, consult your healthcare provider if you don't want to use hormones and you want to try other things, but at least have a discussion.
Yes. See what's
What
best for you.
right, what you're looking to use,
Mhm.
and make a decision together moving forward, right?
Okay. What
Um,
about the
so
tests, the various tests that women should continue as they
right.
transition?
So you've asked about pap smears and mammograms. So those do continue, right?
Okay.
Smears is dependent of it, and I say this because we do in our setting have quite a number of persons who have uterine fibroids
Yes.
and as such may have complications of that and have hysterectomy, which is removal of the uterus. Okay,
Yeah.
surgical removal.
Mhm.
So you can get a surgical menopause because if they remove the uterus along with the two ovaries, well, you have no ovaries, so then automatically.
Yeah.
So the recommendation for pap smear is dependent on that.
Okay.
Okay, whether or not a uterus is still intact and why the uterus was removed. But usually the pap smears continue as recommended.
Yes.
And mammograms do continue also. I think it's up to age 70 or 75 that they state that then you can do as necessary.
Okay. Awesome. Um, I think we've covered most of everything that I needed to touch on. We've talked about what it is, who it affects, how it affects them, the challenges that are associated with it, the various care options that are available through discussion with your healthcare provider. How does it affect your sex life and what can be done to assist you in those areas as well. And remember that you're not only doing these things for yourself, but you're going through this with a partner or a husband or um, other
Even
family members that are there with you because you're not
children.
meant to. Yes, for sure, children. We always forget them, but we know that some people still live at home and they depend on their children to assist them in management and care when they get to a certain age. And we know that that can be very burdensome for some. So to go through this process with those persons is also very, very helpful. We know that you have to continue your annual exams, your pap smear, your mammograms, and look into the various options as it relates to hormone therapy. And you're not staying on them for too long. You're discussing it with your healthcare provider to see what is the best action of treatment. We are encouraging a holistic approach. So you're not just looking at a healthy diet, but you're looking at exercise, you're looking at yoga, you're taking care of your mental state, and all these other things that play a vital role into a healthy and holistic body as well. Dr. Whitby, is there any other key points you would like to make as it relates to menopause before we wrap up? Because we've touched, unless you wanted to expand or talk about other research that you have found and how that affects the Black community. Any other key points that you would like to share?
There are a lot of myths out there, right? And with any topic, you always want to address myths.
Yes.
And say what the facts are. So people think menopause begin at a specific age. And thinking, oh, I reach this age, why am I still getting periods or so forth? But remember, there's an age range. It's going to vary.
Yes.
It could start at 40 and up to age, as I said, by 58, we expect most women would have already not stopped having periods, right? We talked about sex. Some people think no more sex life. Yes, there can be some challenges, decreased libido and so forth, but persons can still enjoy sex. It is not a disease. It is a natural part of aging.
Yes.
Not it is.
That's what we tend to forget. It's natural. The body has to go through it.
Yes, it's just that the experience is different for some and it comes with some challenges for others, right? You can manage, with right food choice, exercise. Your signs and symptoms might be different. Not everyone will have hot flash. Okay. And it's not the only thing that persons can get as a part of the process. And it does impact women's health. It does has, an emotional, psychological impact on women. And women at this time in their life need support. Not that we don't need support other times too, but family, friends have to understand the challenges that could come with it and provide support. And also healthcare providers, need to provide support during this time.
Now that you say that, I have a question. For a person that may have been experienced like PCOS or endometriosis and those other gynecological challenges, how does it affect them when they get to that stage of menopause? If they're
well, as I said, there are studies that show that persons with these premenstrual issues may have the more symptoms or severe symptoms, right? However, it in some cases it may, that's the thing, it varies, it may improve, but it may not.
Okay.
It may not. And some persons still end up having, it's not just uterine fibroids that persons get the uterus taken out for. Endometriosis is another one.
Yes.
Need to get there, because of still having heavy bleeding, a lot of pain, and so on and so forth. So they could have more severe symptoms, as I mentioned, but again, there's no definite thing that says yes, because you have these, you will have a bad menopause.
Wow. Okay, because they know that they go through many challenges already, and then when they get to that stage, to have to go through more challenges, it can be quite disheartening. But as you rightly said, there are options, and in speaking with your healthcare provider, I'm sure that they will find the best solution to help manage the care and pain management that individual will need. Yes. So have you covered all the myths that you wanted to share? Because are there any other tips that you would want to share with us? If not, we've reached the end of our episode. We've touched on all the key points that we needed to share as to what it is, who is affected, what care options there are. And even in watching this video, if there are any concerns that you may have, you can reach out to Dr. Whitby-Best at the Student Health Clinic, or you can speak to your family physician and ask your questions. Don't be afraid to ask questions. I mean, it's your body. We all need to get familiar with our bodies and how they function, so that when something is not right or not in alignment with the way that it should function, then we know, well, yeah, we need to seek care and be okay with that. Some people don't like to seek care. They think, oh, that's gonna go away, or I can treat this at home by myself or whatever. But ask questions, lots and lots of questions, and be okay with receiving help where possible. So Dr. Whitby, I just want to thank you again for this very casual and informal conversation of mastering and managing menopause. As we said at the beginning, most of the information shared is geared towards cisgendered females, which is the person that was born as a female and has stuck to that assignment of being a female. And we have touched on the experiences of transgender women. We didn't go through a whole range of it, but we do know that there are remedies out there for persons that go through that transition as trans women, and there are research out there that you can look into as well. So we thank you again for listening, and if there are any questions, queries, or concerns, you can always reach out to us. And do have a wonderful afternoon, evening, or good morning, wherever you are, at whatever time of the day you are watching. Thank you and goodbye.
Bye.